Well, several committees have addressed the topic of prevention of chemotherapy-induced nausea and vomiting. We are at ESMO, and ESMO collaborates with MASCC, the Multinational Association for Supportive Care in Cancer, and we have produced guidelines. So what I presented here was a survey to understand whether or not the guidelines were actually followed. To our dismay, in observations that were extrapolated from telephone interviews of doctors in 5 European countries, we found out that even in patients treated with cisplatin, which always induces nausea and vomiting, 13%, 1/3 of the patients had no prevention of nausea and vomiting. And then we had patients in the setting of carboplatin, which now in all guidelines is a setting in which you should use a triple association of an NK1 receptor antagonist, a 5-HT receptor antagonist, and corticosteroids. And there, about half of the patients did not receive that, and a small proportion, like for cisplatin, had no adequate antiemetic treatment. So what is obvious is that this shows there's a lot of education still needed in Europe, maybe also elsewhere in the world, because we do have studies that have looked at the implication of adherence to guidelines, and they have shown that if you adhere to guidelines, patients have a 10 to 15% absolute increase in chances of not having nausea and vomiting, and this has been shown in American and Asian and European studies, but unfortunately all of the studies showed that physicians still don't read guidelines. The only way to get guidelines implemented in the perspective of most of my colleagues at MASCC is that it should be automatic when you prescribe a chemotherapy that the per guideline antiemetic association comes in. Doctors are very busy, they are learning about new, exciting treatments, and they tend to forget these essential approaches for patients. So what can we do about that? In those countries that have electronic medical records, it's relatively easy to implement. In others, it will be more complicated. But anyway, education at every single medical oncology congress is needed. So we will see.